So we do provide the full breadth of services that support an ASC, starting with opening an ASC with the feasibility assessment, development, management, but also for existing surgery centers that might have a knowledge gap or may need some interim leadership or may be getting ready to go through accreditation, recertification, any of those pieces. We are happy to come in and provide just those services sort of on an a la carte basis that you may need, based on where your surgery center is today. So again, our approach, we feel is very unique in that we want you, the physicians, to be 100% owners of your surgery center. Our consultants, I only hire 18 members. We only bring on to our team the folks that have been proven in the ASC industry. They have a track record of success, and we know that they're going to bring tremendous value to your project. So in our experience, some of the key elements that make an ASC successful are, again, starting from the beginning with great market research and a financial feasibility, a really, really efficient operational structure, compliance and regulatory readiness, smart vendor contracts, and effective staffing and leadership. And leadership can be your administrator, it can be your board. So now we're going to turn into sort of the nuts and bolts of our approach to starting and developing an ASC. So we look at this in 6 different phases. So the first phase is planning and feasibility. The second is organization formation. The third is design and development of your center. The fourth is operations preparation, and that is getting the center, once it's built, ready for that very first patient. That very first patient deserves to have the highest quality, safest care, and we need to make sure that your staff in your surgery center are ready to deliver that high quality care. Then we're launching your center, and there's a whole host of things. When you open a brand new surgery center and you see that very first patient, it does not mean that you can bring all of your cases to your center. It is the trigger for the sort of next phase of accreditation, licensing, payer enrollment. So from the time you open your doors and see that first patient to the time where you are going full bore, that period can be 4 to 6 months. And so you need to be able to plan for that. It doesn't mean you can't do cases, but you're not going to have that full ramp up right when the doors open. And then the final piece is really ongoing optimization. Once the center is open, how do we really manage that center to the top quartile of performance? How are we meeting and exceeding those benchmarks?